Thank you. Thank you, everyone. I think, Professor, you have made it, and I could realize that you are annoyed because people are not respecting what you teach in the university. I think nutritionists need to wake up. That's number one, because we are not reading. We are using our old traditional knowledge of primary school food and nutrients, and believe that meat is protein, that ugali is carbohydrate. And I would want to inform all of us that we need to separate food, nutrient. So even when it and drugs. So when we are talking about food interaction, it's different from food nutrient interaction. It's also different from nutrient interaction, and then drug nutrient interaction. So we must treat food as food, and we know that every good food have several nutrients. So there is protein in the meat, and there's also carbohydrate in the meat. So that's the difference. And so whoever is asking that question, we kindly ask you to attend this most of the times. I've also seen nutritionists asking for jobs. Now, if you went to be given a job in a health facility and you're supposed to advise a mother, and you tell them that if you want a lot of protein, yes, if you want protein, get meat. That is what we say most of the time. If you want protein, get meat. Or you can get some small fish or some white meat, the fish, the large fish. That's true, but that is not the reality of science, because that is food. And so if you give them fish, they are likely to get more nutrients other than just the protein. That's what Professor is saying. So if we don't go back to class or we don't attend meetings like this where we talk about science, then we are likely to lose, and then we give wrong information. So nutritionists, wake up, because we don't want you to annoy Professor Nguka next time. Thank you very much, Prof, and thank you everyone for attending. For those of us who are saying, we have the Italian group here with us. We have been collaborating for quite some time. For those of us who are online and are saying that we also want job links, there are jobs everywhere. The first is to create the job on your own. And the second is to get connected. And I agree with you, we shall get connected if we improve our science, isn't it? If we improve our science. Good. So are we on? I can see the screen is off. Technical team, I want to be sure that we are on. I'll take the shortest time possible. We are online for those who are on YouTube, so we can go on. Good. Food choice dilemma. I want to start by saying that we have had the Italian cuisine, and by the introduction given to us from the ambassador's remarks, it was very clear that Professor Fabio is talking about not just food, but also a lifestyle. And when you talk of a lifestyle, it goes beyond just the food and the science behind the food. It also goes on along with the cooking. Now, at some point, we have been solving the problems of nutritionists everywhere. Because when you ask a nutritionist whether they are a cook, they are cooks, they will tell you that they never studied cooking. So then why did you study? Because you cannot talk about the dry science of food and you can't cook that food. So one of the weakest points of nutrition is how to cook. If you go to the villages and even to households in major towns, what is cooked as food, yes, is a combination of ingredients, but has no touch of feeling and food itself. Even service is out of place. And this is the problem we have, even in our hospitals. When food has been cooked, the way it is served discourages the patients, the first sight. The presentation of food is not given focus. So there's no touch, there's no feeling between food, the person eating it, and the environment. That is where meal experience becomes critical. It's not just about what you take into the stomach. It's about what you experience on the table. That is why somebody will leave you with your food in the house and they go to a hotel where they will be presented with a platter of Italian cuisine or any other international cuisine, because then there's a touch and the feeling. So if we want to avoid ourselves running to restaurants, let us bring meal experience at home. So turn your science to cooking, real food. And so let us become better cooks. I am a better cook. Say here. I know you may be looking at me and thinking that I'm just talking. I know how to make food that will make you happy. And I know how to present it well on the table. And I was taught how to do service. Now, the current nutritionist we have in the country only knows maternal and child health interventions, or malezi bora. But they cannot tell the mother how to cook that food. Are we together? We want to move away from the science to food. But before that, we must give you the science. Now, food choice dilemma. Why am I talking about this? Right now, we do not know how to choose food. We also find problems how to choose food. And the game that we have seen in social media or even in classroom is that we are moving away from animal food towards plant food. If you are to talk with the Seventh-day Adventist, what they're preaching is plant-based diet. And so people believe that we have to go plant because they see risk in animal food. I also see risk in preparation of food. And so the freshness is very important. I wanted to bring that background so that we are sure of what we are going to say. Now, the 21st century, where we are in, and I'm talking about this because you and I are affected. Low and middle income countries have experienced a dietary transition with a shift from traditional to Western diets, which is a high risk. We know that a Western type of diet is characterized by saturated fats, high sodium, high sugar, high meat, high dairy products. I went to South Africa, and every restaurant in South Africa, for example, any food on the table has sugar added to it. So if it is meat, then it must have meat plus sugar. If it is chapati or any wheat product, there must be sugar. And so literally all food in their recipes and menus must have ingredients called sugar. Further to this, high levels of cases with metabolic syndrome, now as scientists, and early mortality has been experienced, even in Kenya. We are now struggling with NCDs from all angles: the diabetes, coronary heart disease, arthritis. There are so many currently. And why are we talking about the risk? Because for you and I to live longer, we must also eat well. And we must get food that has a touch with the feeling and also with the body, and then targets good health. If we look at the disability adjusted life years now, it has been much affected by the kind of diet we consume. And so millions of deaths and millions of disabilities come as a result of the food we give out. 70% of deaths in the hospital is because many of us were not properly fed. So we went when we were well in the hospital, but we came out more sick because the one who provides that diet does not know how to cook. The one who understands the science of cooking also does not know how to cook. And that is you and I in the hospital. But they will do theory and tell you this is how we give diet counseling. So they will counsel you on what to take, but they have not shown you how to prepare what you are supposed to take. And with that, then you go home in a dilemma because you don't know even how to choose the food itself. So it is high time we moved from our current thinking of science to think better cooking with science. Better cooking with science. And now, better cooking has been described to us today as freshness, the feeling of touch, and also the meal experience. When we were coming up with a very specialist scientist here that we have labeled as food service diet therapist, who is a dietitian in a specialized area of food, which is cooking and service. We have only had not more than 15 since we began training in Kenya. This is a dietitian that will cook with some science and also serve food with some science. And they're supposed to work with the caterers in the kitchen if it is specialized hospital facility. Now, this dietitian should be able to tell us how to serve food. If food is not consumed by the bedside, what is the reason why it was not consumed? Is it because of the presentation? If you give me a plate of ugali, you know it is also in Italy, and you have cabbage, and you have meat, goat meat, or red meat, and they are all put in one bowl. Is that a sight that I can eat? But what about if it is well presented, that each of them have their own compartment? And on top of it, you are advised, very delicious, please go ahead and eat. That is a service experience. Even the talk of how you present that food to the patient is very important. But what will we say as nutritionists? I studied science, I did assessment, and then now I know what to prescribe for you to become healthy, but I cannot make it. But I cannot assist in making it. I cannot assist in food choice. So I want us to look at this food choice dilemma from a perspective that we already have a threatened life. We have what? A threatened life. And when we talk of threatened life, we are looking at the health status of human beings, both healthy and unhealthy ones. And we are also looking at us as the solution. So I will want to focus on risks associated with animal food, and then I end up with the plant-based approach. Now, it is evident in science, for those of you who have studied science, that many foods on the table are of animal origin, and this contributes to a population's diet. And therefore, the impact on nutritional status and well-being cannot be undermined. If you get into the usual Kenyan cuisines, you cannot miss to see animal products in the menu. If you go to any restaurants, you cannot miss to see animal products in the menu. Enhancing food security by increasing, thank you, production levels should be sensitive to the environment also surrounding that animal. As we eat a lot of food, we also know that the animal food contributes more to the destruction of the environment when it comes to the carbon footprints. You know that. So we are looking at eating habit and how it affects the environment as a whole. And when the environment is affected, then we cannot find vegetables because they solely depend on the ground. So we see a lot of effect when we turn to animal food. And so we are saying it is essential to recognize food of animal origin as a factor in improving nutrients. That is beyond science. So we know that. And so you cannot say that let us remove completely animal food from our diet, because at some point you may need it because of the risk. Now, we have looked at the dietary patterns when it comes to animal food or food of animal origin. We see also on the right-hand side the risk of non-communicable diseases. And when we talk about this, we need to scrutinize the animal food in relation to the NCDs or our general health status and see, is it possible that we can shift to plant or we can balance? And so we understand issues to do with the current climatic change in our environment. No country can say that they are safe when it comes to issues of climate. We have been told, the focus is on climate, and this is now called planetary health. But what contributes to bad planetary health? It is the food we consume from production that is filled to the fork. And so the animal food has been accused to be the one that is behind the destruction of the ozone layer. And of course, because of the carbon footprints, changing the climate. And so we know these animal foods are from poultry, pigs, among others, and all of them are brought to the table in form of sausages. And to some extent, even when it comes to just general diet, you can find pizzas with animal products. We can't miss it. And we see, therefore, that this becomes a serious debate because then some say, even those animal foods contain some zoonotic diseases, making the risk to be too high. So because of that, we see now a shift towards plant-based diet. And many people will tell you that we have to go plant. Even where you are seated, I know some of you have said we must go plant way. And so people will be telling you that, for us, we want to move away completely from animal sources and go plant way, not knowing that also there's a risk when you don't consume animal products, particularly when it comes to some specific micronutrients, which are high in animal products. So is it the balance or is it 100% plant? And this brings me to the key thing that I wanted to say about this topic today: the plant-based approach, sustainable dietary guideline. We all know in Kenya, we do not have a healthy diet guideline. If any one of you knows that there's one, you can educate me here. I have seen something which was developed by the Ministry of Health, which is written Healthy Diet Guideline, but it has not been tested. That has been developed by a group of people looking from the Google and a few songs here and there, and they put it together and call it healthy diet guideline. It's not tested based on the current local foods and the current diet plans and menus that we have. And so we cannot say that it's a healthy diet guideline. Now, given the previous attempts by the World Declaration and Plan for Action for Nutrition, that was spearheaded by the FAO and WHO to promote and disseminate dietary guidance on best practices in nutrition, we have limited information on implementing it within the public, particularly even in Kenya. And so the new area of focus is pointing at guidelines that target planetary environment boundaries and, of course, mortality. And so if we were to come up with a healthy diet guideline, we think about the planet, we think about human health, and we also think about risks. And in this case, then, we must come up with a healthy diet guideline that will meet the interests of the humanity and the planet as a whole. Now, because of this, nutritionists and, of course, food scientists and dietitians, and, of course, cateresses or the hotelier, the chefs, we must come to the table. Why? We must know how to cook, and we must know what to cook. And if we want to know what to cook, we must know the science behind what to cook. And so we must now change our mentality from just science to recipes and menu plan. To recipes and menu. If we go to a restaurant and I'm a nutritionist, I should be able to determine whether food on the table is meeting the requirements when it comes to healthy diet. That is a missing link in our science as nutritionists. With collaboration, it would be possible. Now, the first index in the planetary health diet, which attend to adhere to the planetary diet, was done by Kako in 2021. In this index, we have 16 components, each ranking with a minimum of 10 and out of 5 points, which are used to score in the rating. And we have found out that in this, the planetary health is in consideration, particularly when it comes to carbon footprints. And so this index, if you look at it, if it is displayed, it will show you a study which was conducted for a diet pattern that will take care of the planet and take care of human beings. And it is moving towards sustainable diet, particularly human health. The second index was Sustainable Healthy Diet Index, the shared index. Of course, that is also taking care of nutritional, environment, and socio-cultural aspect. This is the only index that brings in humanity in the picture of eating. It recognizes that food is also for social interaction rather than just eating. If my food cannot make you happy so that you can converse more, then it is not food. It will be like supplements. I was saying if you give people a chance that if they take one pill of protein and they can survive for the rest of their life, people will evade or run away from the table, not knowing that food at table also contributes towards good health. The current household in Kenya is where people eat so that they can go and do their business. So people will pick their food, they go and sit somewhere on their own, they eat, and they run away to work or to class. When it comes to the evening, they sit in Java, they order pizza, and then they say, after that, they go home, no one next to them. When they go home, they sleep. So the social aspect is lost completely. Now, this kind of shared index reintroduces the sociocultural aspect of food. And sociocultural aspect of planetary food is an ecological aspect of nutrition that must be brought on board so that we avoid eating to target status, but eating to target also social perspective of life. So we must come back to the table. What are we saying about the plant-based? Many scientific reviews, of course, if you go to study, you will see them. It is evidence that plant-based diet could be more friendly diet to respond to human and environment. We are not saying that animal products diet is wrong, is bad. This shift is probably a better alternative to One Health agenda in Kenya and also for your own health. However, we require a lot of proper dialogue between the food scientist, that is nutritionist, dietitian. Social scientists must also come on board. And of course, those who implement policy. Our food systems, as well as food with chefs, is very important. We can't lose out on the chefs when it comes to matters of nutrition. So bring in science, let the chef bring in the art of combination of food. Let the social scientists bring in the social interaction around the table. When we promote this agenda, we'll be moving towards healthy eating so that we don't just look at food as an item for treating disease. We look at it as an item for prevention, as well as a social pull item. Food can be used to punish, to reward, and also to build friendship. Anytime you go to the table with your friend and you order a nice meal and you eat as you converse, you come out better than when you eat your own food in your bedroom. And that is why, as nutritionists, we must start thinking, how do we link up with the chefs? How do we bring on board the art of cooking as a key competency in nutrition? How do we bring on board the social scientist, the anthropological movements when it comes to eating? How would we come on board with different variety of cuisines from different social settings that would bring us to the healthy eating habit across board? How do we minimize the risk to health? So what I wanted to bring on board is that food is not about the nutrient and disease. We are losing on social aspect, social cultural perspective of food. The cuisines must come back and we must study different cuisines. Now we are here with Italian cuisine. If we work very well and we ensure that we get different recipes, like what has been given to us by Chef in his book, we probably may come up with different ideas on how we can present our food, which is healthy. Remember, the background is freshness. It's the social aspect and the combination in that food. If we lose out on that, then we don't talk nutrition. We don't talk dietetics. So we must wake up as nutritionists to now say that we are better cooks with science. But if that is missing, then we have a series of webinars where we can bring on board different chefs so that they can teach people how to cook food, not just how to use food to treat, how to cook food. And that can solve your problems at household level. Many husbands have run away because their wives didn't know how to cook. You shall not be one of them. If they run away, They will be pulled back by what you put on the table and how you present it. Many restaurants have been closed because the chefs there did not know how to cook. And many hospitals have suffered and have killed many people because the nutritionists there, the cateresses, and the chefs didn't know how to cook. It is the time for us to do that. Thank you very much.